among the plasma proteins, we are going to see the most important plasma proteins like albumin, globulin and fibrinogen. Okay, there are so many plasma proteins, more than 200, 300 plasma proteins. But based upon the concentration level, we will see only few plasma proteins into the scenario. Okay, so that is albumin, globulin and fibrinogen. So first we will see about the plasma proteins. So what is the main role of plasma proteins? The plasma proteins, the normal value you will see 7.3 grams per deciliter on the overall value of the plasma proteins. Among that, we will consider only few plasma proteins like albumin, globulin and fibrinogen. We will term the albumin and globulin also as serum albumin and serum globulin. Why? Because the serum does not contain fibrinogen. So we will say only the albumin and globulin as serum albumin and serum globulin. If you take serum, it is equal to plasma protein minus fibrinogen, because serum does not contain the fibrinogen. Fibrinogen is the clotting factor. Okay, serum will not clot. So serum does not have the fibrinogen. If you take a blood, whole blood centrifuge, what is being remaining in the topmost portion after the centrifuge process? Yellow color buffet coat is being seen. That is the serum. The plasma cellular elements will remain in the lower part. See, if you take a test tube and if you fill the test tube with the blood and you do the centrifuge process, the top layer is serum. Only you will have the serum, and this part is containing the plasma and then the cellular elements. Okay, clear? So now the serum albumin, the normal value will be in the 3.5 to 5. See, in physiology, we will not say any fixed value as a normal value. You will have a range. So that is the physiological limits. Okay, the normal value in the physiology, you will have a range from this to this. Okay, so you will have 3.5 to 5 gram percentage, and for globulin 2 to 3.5 gram percentage. For fibrinogen it is 0.2 to 0.3 gram percentage. And you will also consider albumin is to globulin ratio. So usually the ratio will range between 1.8 is to 1 to 2 is to 1. Okay, so you will also have a range for this albumin is to globulin ratio. And this ratio gets reversed. In which conditions? Mainly in case of liver diseases. Because the plasma proteins are mainly synthesized from the liver. Okay. So among the plasma proteins, albumin, globulin and fibrinogen, we will also subdivide the globulins as alpha, beta and gamma globulins. These globulins are the immunoglobulins. They are the antibodies. Okay. Immunoglobulins also called as antibodies. So among this, the gamma globulin, it constitutes the higher concentration of 0.7 to 1.7 gram percentage. And then the other globulins you will term as in the alpha 1, that is antitrypsin, alpha 2 as macroglobulin. Just remember these terminologies, that is enough. And coming to the origin of plasma proteins, they are mainly from the mesenchymal cells in the embryonic stage. And in the adults, mainly synthesized from the reticular endothelial cells of the liver, spleen and the bone marrow. They are the reticular endothelial systems. Okay. So from the liver, you will get albumin, globulin and most of the clotting factors. If there is any deficiency of the clotting factors, it is not only related with the blood cells. You should also consider the liver function, because The liver is the place where the clotting factors and the plasma proteins are being synthesized. If a person is having hemophilia, it is not only related with the clotting factor, from where the clotting factor is produced, liver. So you should also consider the liver function in case of bleeding diseases. Okay, and the liver disease, you will have a marked fall in the plasma protein level and the clotting defects. And mainly the gamma globulin, it is produced by the plasma cells. Plasma cells is the place where the antibodies are produced. Among the globulins, gamma globulin is also called as immunoglobulins. So plasma cells is the one which is giving rise to the immunoglobulins. And also the B cells. Among the lymphocytes, you have T cells and B cells. This B cells is also giving rise to plasma cells and memory cells. So this B cells, one of the subtype is the plasma cells, which give rise to the antibodies. So apart from these reticular endothelial structures, what are the other sources of plasma proteins? From where also you will get the plasma proteins? One is the macrophages, which is also having the role in the complement system. What is complement system? Have you heard about the term complement system? Complement system, it is one of the system which you will come across in microbiology. Please turn off your phones. Put it in silent mode. Oh. Okay. So the complement system, which is having a major role in encountering the microorganisms. Okay. So that complement systems is happening in the macrophages also playing its role. And then disintegration of blood cells will also give rise to few plasma proteins. And then the apoproteins, which is also a plasma protein, but its concentration is very minimal. So we will not consider as a major plasma protein. And the endothelial cells like plasminogen activator and von Willebrand factor. So when there is a rupture of the blood vessels, this give rise to the exposure of these plasma proteins. These concentrations we will not consider to the maximum level, but this too is having its major role in the secondary hemostasis, that is coagulation pathway. It is having the major role. And what will happen if there is any variations in the plasma proteins? So always in physiology we will see what happens if the value increases, decreases, hyper and hypo. So hereafter in the blood cells, hyper, hypo, we will see most of the variations. So hyperproteinemia, when there is an increase of plasma protein concentration, so it is mainly in the gamma globulin. So during inflammation process, in order to encounter the infection, and during pregnancy, as you people said, and during menstruation process. So there will be increase in the plasma protein concentration. And hypoproteinemia mainly during malnutrition and during the kidney failure process. Okay. And albumin loss. When there is albumin loss, albumin is the one which is maintaining what? Oncotic pressure, which is involved in maintaining the osmotic pressure. This oncotic pressure, osmotic pressure, the pressure which is maintained by the albumin for osmosis, that is called as oncotic pressure. If it is maintained by the colloids, you will term it as colloidal osmotic pressure. Overall, what is this osmotic pressure is doing? It is preventing the movement of water inside the cell. Okay, so albumin is the one which is one of the plasma protein maintaining the oncotic pressure. If the albumin is lost, there is decrease in the albumin concentration, the water content will move inside the cell, resulting in edema. That is decrease in the colloidal osmotic pressure. Okay, in case of renal diseases, you will encounter edema, centripetal edema, and then orbital, periorbital edema. And when you see, you will categorize nephrotic or nephritic conditions based upon the albumin level. You will encounter and differentiate. Okay, so this edema, centripetal edema, is one of the indication of glomerular damage. Usually, plasma proteins will not be filtered in the glomerular membrane because of the increase in the size. Proteins will not get filtered in the glomerular filtration mechanism. If you will encounter urine albumin, it indicates there is damage in the filtration structure. Glomerular filtration is not functioning properly. The Bowman's capsule is having some abnormality in its pore size. That is why the albumin is filtered and it is being released in the urine. So you will have albumin decrease in the body. So that leads to loss of osmotic pressure resulting in edema. Okay, the plasma proteins, its concentration is very minimal, but it is more important in the clinical diagnosis. Okay, clear? Among the plasma proteins, albumin and globulin plays a major role. Fibrinogen is having the major role in the coagulation process. Okay, clear? And then afibrinogemia, that is the term A indicates absence. Okay, decrease of fibrinogen. So I said, when there is a bleeding disease, don't think only about the clotting factors. Think about the place where the clotting factor is synthesized. That is in the liver, mainly liver cirrhosis, hepatectomy. You will encounter decrease in the clotting factors, decrease in the plasma proteins. Okay, and during hemorrhage, excessive blood loss. Kidney diseases in the sense, the filtration mechanism, mainly the loss of the pore size will be increased, all the plasma proteins will be excreted via the urine. So it will not remain in your body to perform its function. Like nephritis, I said nephrotic conditions, nephritic conditions. Okay, so various things will take part its role in decreasing the plasma proteins. And next, in all these cases, the albumin is to globulin ratio. So this is one of the most important investigation parameter. The albumin globulin concentration and the albumin is to globulin ratio will make you to diagnose from where the clinical scenario is taking place, which organ is involved in this condition. You will encounter this. Okay. And then in liver diseases, multiple myeloma, myeloma in the sense it is involved with the bone marrow. Okay, so you will encounter the clinical conditions. And then coming to the properties of plasma proteins, we have already seen just an overview. The molecular weight, there are so many plasma proteins, more than 200, 300 plasma proteins present in our body. But based upon the molecular weight, when you do the electrophoresis process, okay, you will see only the molecular weight which is higher, that we will consider into our studies. Okay, so among that, this 3 is having the higher molecular weight when compared to other plasma proteins. So that is 69,000 Daltons, and the globulin is 90,000 to 1,50,000 Daltons, and fibrinogen you have 3,40,000 Daltons of molecular weight. And the oncotic pressure also we have already seen, and albumin plays a major role, that is 25 mmHg, which we have already seen in the osmosis, and the specific gravity of plasma proteins is 1.026. And this plasma proteins also having a major role in the buffering mechanism, acid-base balance maintenance. Okay, in the acceptance of H+ ions. So that is about the plasma proteins. The plasma proteins having only a very least composition in the blood, but it is having a major role in maintenance. Okay.